All right, guys, welcome back to Underground Science. In this video, we'll be talking about anti-phospholipid syndrome. Okay, let's go and get started. So in the previous video, when we talked about lupus, right, we mentioned that we can see certain anti-phospholipid antibodies along with the ANA, along with the anti-double-stranded DNA antibodies, along with the anti-Smith antibodies, right? We can see anti-phospholipid antibodies. Now, this can be associated with SLE, but notice we said can. Okay, you can also have anti-phospholipid syndrome, right? Antiphospholipid antibody syndrome or antiphospholipid syndrome due to just being primary, right? It doesn't have to be associated with lupus. Okay. So the antiphospholipid antibodies that we can see, right, are lupus anticoagulant, anti-beta 2 glycoprotein 1, and anticardiolipin. Now, anticardiolipin is interesting because this can lead to a false positive syphilis test, like a VDRL or RPR test, right? So if you were to do this test, and it came back positive for anticardiolipin antibodies because you would see it's you can see anticardiolipin antibodies in a syphilis infection, right? So if you did a VDRL and RPR and it came back positive for anticardiolipin antibodies, right? Anticardiolipin antibodies, then that and but then if you also know that it's a lupus patient, right, who has antiphospholipid syndrome, for example, then of course it's going to be a false positive because you don't actually have syphilis. You have antiphospholipid antibodies due to antiphospholipid syndrome, and that antibody being anticardiolipin. Okay, so let's focus on lupus anticoagulant, anti-beta 2 glycoprotein 1. Okay, antibodies. So it turns out these antiphospholipid antibodies, right, can bind certain areas and lead to a hypercoagulable state. That's what antiphospholipid syndrome is. It's the presence of antiphospholipid antibodies and the presence of a hypercoagulable state. So on your endothelial cells, right, you have certain you have beta 2 glycoprotein 1. Okay. So you can have beta 2 glycoprotein 1 that can be bound onto phospholipids that are present on your endothelial cells. Antibodies like lupus anticoagulant and anti-beta 2 glycoprotein 1 can bind onto these beta 2 glycoprotein 1 proteins, right, which are bound onto phospholipids on your endothelium and lead to what? Endothelial dysfunction, and it can increase the expression of cellular adhesion molecules. Okay, so not only does it cause endothelial dysfunction, it increases expression of cellular adhesion molecules, which we know attracts white blood cells, and it increases the expression of tissue factor, right? Factor 3. And we know this is part of the extrinsic pathway of the coagulation cascade. So this can induce clotting also. Okay. And endothelial dysfunction, we know, promotes clotting also. Okay. So that's that, right? So that's what happens if you have your antiphospholipid antibodies, antiphospholipid antibodies like what? Like anti-beta 2 glycoprotein 1 and lupus anticoagulant that can bind to beta 2 glycoprotein 1, which is a protein that's bound onto phospholipids on your endothelial cells, okay? But you also have beta 2 glycoprotein 1 that's also bound on your platelets, okay? You can find this protein bound onto platelets. So your antiphospholipid antibodies like lupus anticoagulant and beta 2 glycoprotein 1, right, can also bind onto the beta 2 glycoprotein on your platelets. If that happens, that leads to the activation of your platelets, right? So activation and aggregation, and then this leads to thrombosis because that's what platelets do. They make clots, right? So then that increases thrombosis risk like DVTs, pulmonary embolism, stroke, myocardial infarctions, and miscarriages. Okay, and something else to know is that in patients with antiphospholipid syndrome, right? You have a hypercoagulable state. You form a lot of clots. And if you form a lot of clots, right, like in small blood vessels, then you can have something called levator reticularis. Okay, so we have to actually talk about levator reticularis because it's kind of interesting, right? You can see levator reticularis, for example, if you have obstruction of your blood vessels, right? So if you have obstruction, so like in clotting disorders, right, where you form clots, microvascular clots, and you can see this in like if your blood vessels massively constrict, right? So any irritation basically to your lining of your blood vessels can lead to thrombosis, right? So even in conditions like certain vasculitides, right, you can see livedo reticularis or certain clotting disorders that make you clot more than usual, right? Like we're talking about right now, antiphospholipid syndrome, lupus. Because remember, you can have vasculitis and lupus too. Okay, it's important to know that too. In lupus, you can have vasculitis because you can have those antigen antibody complexes deposit in your endothelial wall, right? Your vascular wall. And this can lead to inflammation and vasculitis and therefore clots and atherosclerosis and whatnot. Okay. And then, of course, in certain diseases, right, like factor V Leiden or protein C deficiency, protein S deficiency, because we know protein C is an anticoagulant. So if you're deficient in that, you're going to be procoagulant. And we know factor V Leiden, right, in that disease, you get a point mutation, remember? So in factor V Leiden, you get a point mutation, which basically makes factor V resistant to inactivation by protein C, right? Because remember, what does protein C do? It tries to inactivate factor V and 8, right? But if you, in factor V Leiden, protein C isn't able to inactivate factor V and 8. That means you have more coagulation factors, more clotting. Okay, so anything with increased amount of clotting, increased vasculitis, and things like that can lead to livedo reticularis. Now, what is livedo reticularis, right? It's actually kind of cool how this works. So remember, we have capillaries, right? So what's the normal flow of blood is arterioles. So we're gonna have arterioles that will branch into smaller capillaries, right? And then these capillaries will eventually, we'll see veins or venules, right? And these venules will come together and form veins, right? So let's just say all these come together and form a vein. So what happens is, right, remember, the blood flow is going like this, right? So let's draw it in another color. The blood flow is going like this, right? So in normal skin, we have normal blood flow going through your arterioles, going through your capillaries, venules, and veins, and proper drainage is occurring. If you have a lot of vasculitis, a lot of microthrombi in your small blood vessels, right? In your small arterioles, like let's say here and here you have small microthrombi, and so that what does that mean then, right? Not much blood. You won't have proper flow of blood, right, through the system. So you're not going to have proper flow of blood through the capillary bed. So you're going to have some areas, right, that are going to get ischemic because you're not having proper blood flow to certain areas of your skin, let's say. So let's say this part gets ischemic and blue, right, and mottled. And then other parts, right, what's going to happen is if your capillaries are underperfused due to the fact that you have small clots in your arterioles, so not much blood makes it down to your capillaries, then that means not much blood will drain from your venules, right? Venous drainage will slow down if capillaries are underperfused. Okay, so your venous drainage will slow down if capillaries are underperfused. All right. So if blood flow is coming this way and not much blood is able to reach the capillaries due to small clots in your arterioles, then that means your drainage, your venous drainage will also slow down, which means blood will pool in your venules, right? And then you get dilated venules. Okay, and you get dilated venules. So your veins get all dilated, right? Like this. Your venules can get all dilated, and then that shows as purple mottled lines. Okay, so this can show as purple mottled lines, and this is the classic pattern that you see in livedo reticularis, which is you see mottled reticular pattern, mottled and reticular pattern, so a net-like pattern, and purple discoloration. Okay, so it's pretty interesting of how you see the pattern of livedo reticularis, okay, and how that happens. So that's basically antiphospholipid syndrome, right? Um, I hope this video wasn't too confusing. I hope this video helped a little bit. Thank you guys for watching and see you guys in my future videos.